Before moving a patient, we want to make sure we have all the lines in proper placement. We want to know where they are. Right now we have an oxygen tubing, NG, we've got a catheter and IV. We're going to be moving the patient over to the left side, so we want to move all the lines over to the left. And we'll also move the IV over this way. So you want to make sure you have enough slack in all your lines so when you move them, nothing gets pulled out. And first we're going to work on boosting the patient. So in order to boost the patient, we want to raise the bed up. So before we move a patient or boost a patient up in bed, we want to make sure that we're bringing the whole bed up so that we can protect our backs. So right now I'm going to raise the height of your bed up before we boost you up. Usually you want it about waist height, so I can use my legs and my arms when we boost her up in bed. You always want to talk to the patient and let them know what you're going to do. Danae, in a minute, what we're going to do is we're going to boost you up in bed, okay? So we're going to have you bend your knees up, and if you can help with your legs, that's going to help us. So just to help bend their knee, you can go on the outside of their foot, and you want to push their toes towards their nose. And I'm also going to go under her knee to help facilitate. So I'm going to push her toes towards her nose and go under her knee to help with the bending. That's how you can facilitate bending the knee. Just like that, on the outside of the foot and under her knee. So we're going to help facilitate going on the outside of her foot. We're going to bend up her knee. You already have your hands. We want your hands on your chest. Then in a minute, we want you to lift your head. But in order to help facilitate us boosting her, we can Trendelenburg or put the head of the bed down. Good job. You already have your knees bent, and we also want you to put your hands on your chest, and we want to make sure you can tuck your head, and then we're going to boost you up. When you're boosting up a patient in bed, you want to make sure that you use the pads. You want to pull that up. You do not want to go under their arms and pull up like underneath their arms, because that could cause shoulder injuries, and we do not want to do that. 1, 2, 3, and push with your legs. There you go. Good job. So now we're going to put the head of the bed. We're going to make the head of the bed flat and put it at normal. Now we're going to work on rolling the patient from side to side. So the pad's not in the position that we want it, so we also want the head of the whole bed up to help us facilitate. We're going to have the patient bend her legs up again. So what we're going to do is going to roll from side to side to help position this pad underneath you. So we want you to reach over for the rail. We're going to adjust that pad. So we'll tuck the pad. I'm going to roll over the other way. Can you reach over with that hand? Okay, now we're going to have you roll this way, please. Yep, we'll get that pad straightened out. Okay. Before you roll a patient over on their shoulder, you want to make sure that you pull out their shoulder blade. So I'm going to go under her shoulder blade and pull it towards me. So that's when you roll them, then they won't be impinging their shoulder. So we pulled out that shoulder blade, and then we're going to roll her. And she can reach over. And then that arm, you can even make sure that that shoulder blade's out. So when you roll them, then you're on that side. And we're going to straighten out your legs. Okay, there you go. Are you comfortable? Okay. So now what we're going to do from you laying down to sitting up on the edge of the bed. And it's going to be a MOD assist. So it's an assist of one person. You're doing about 50% and I'm doing about 50%. So we're going to work together to get you out of bed. Okay, so I'm going to put the head of your bed up a little bit to make it a little bit easier. And I'm also going to lower the bed so we're closer to the floor. Okay, so we're going to try to bend up these legs again, okay? So I'm going to help with that. I want you to hold them there. I'm going to roll you on your sides with this hand. I want you to reach for the rail. And I'm going to come right under your collarbone and help you get up, okay? And you turn, yep, and there we go. And we'll get you sitting up. I'm going to pull you forward a little bit. I'll use this pad and get you sitting up. Does it feel good to sit up? Yeah, good. Okay, so now what we're going to do is we're going to lay you back down in the bed, okay?
Yep.
And I'll put the head of the bed down. Then you're going to come down on this left elbow. Yep, you're going to go there. I'm going to get there. I'm going to get under your legs. We got to watch that catheter. Get that underneath her. And then roll her on her back. And can you straighten out your legs a little bit? There you go. So that's a MOD assist, about the patient's doing 50% and a therapist is doing, or nursing staff doing 50%. So we're going to get you from laying down flat to sitting up on the edge of the bed. We're going to put the head of the bed up to help you too this time, okay, to help so we can move a little bit better. So we're going to put the head of the bed up. Put your knees down. Put the whole bed down. Okay, I'm going to help with your legs and Leisha's going to help with your back. We're going to roll you on the side and we're going to get you sitting up, okay? So we're gonna roll you. I'm gonna help with these legs. She's gonna be right behind you and she's gonna get right in the bed. And if that rail's up, she'd wanna get that rail down. She's right in the bed with her. And if you come sit up, I'm gonna get under your shoulders here. We're gonna come sit you up and she's gonna be right there behind you. We're gonna pull the pad forward a little bit and get you sitting up. How's that? Feel good to be up?
Yeah.
Good. Okay, so in a minute we're gonna lay you back down in the bed.
Okay.
Okay, so I'm gonna put the head of the bed down. Okay, you're gonna come down on this left elbow. Alicia's gonna be right behind you. She's gonna help with your back, and then I'm gonna help with your legs. I'm gonna get you back in the bed. Okay, we're gonna roll you on your side. Yep. And we'll get you straightened out a little bit. Straighten you. I'm gonna get you boosted up, or we'll get you the head up, or the bed up a little bit. Straighten you out. And probably just boost you a little bit. So we're gonna come over my way. We'll come over to the left a little bit. Yep, can you put your hands, and then in a minute we're gonna have you, let's bend up these legs again. And when you're ready, we want you to lift your head up. We're gonna pull you over up and to the left. And we can also put the head of the bed down. We could Trendelenburger to help. Ready? 1, 2, 3. There we go. Okay, now you're laying. Are you comfortable?
Yep.
Do you need anything else?
Nope.
Nope. Has it been pretty quiet around here lately?
Pretty quiet.
Is there anything we could help you with for quietness?
No, I don't
No?
think so.
Okay.
I have my own to myself.
Good. Okay. So now we're going to do a transfer with an orthopedic patient. So maybe they've had a total knee or a total hip or some other kind of orthopedic surgery on their left lower extremity. What we're going to do is we're going to put the head of the bed up a little bit. So Danae, I'm going to raise up your bed a little bit to help us. I'm going to put your knees down so the bed is flat. And then what we're going to do is move from the laying down to sitting up, and I'm going to help with your left leg, okay? So your right leg, I want you to be able to bend that up. Now I'm going to help with this left leg. Can you bring it over to the side? And I'm going to help support you under your ankle and under your knee here, okay? And if I want with your upper body, can you reach over for the rail? Yep, and we're going to slowly, come sit up. Yep, good job. You're doing good. Get that other leg on the ground, and then I want you to use your arms to push forward. We're going to slowly get you sitting, and you're allowed to bend this left knee as much as you can, whatever you can tolerate, and we encourage you to bend it. Okay, you feel okay?
Yep.
Okay, now we're going to just sit here for a minute, and then we'll get moving some more, okay? Now we're going to show you an orthopedic transfer when the patient is max assist ×2. So they're requiring about 75% of the work, and the therapist or staff member is doing 25%. So what we're going to do is we're going to use the head of the bed. We'll bring the head of the bed to help us with the transfer. So that's what I'm going to do right now, is bring the head of the bed up. Okay, and we're going to have one person in the front, so I'm going to be in the front helping with your legs. You always want to communicate with the patient and tell them what you're going to do. So Danae, I'm going to be here in the front with helping with your legs. Alicia's going to be in the back helping with your back. And this is your left leg is your surgical leg, the leg you just had surgery on, so that's what I'm going to really help with a lot. So I want you to try to bend up this knee a little bit, if you can hold it there. I'm going to be under your ankle and under your leg here to help support. So we're going to come, maybe can you scooch to the side of the bed a little bit? Yep. And Alicia's going to be behind you. Yep, good job. Grab for the rail. We're just going to slowly, kind of sit up. And I'm going to try to help, maybe grab the pad a little bit. Can you lean over to the left a little bit? Yep, and we're going to help pull you. Grab this other side, help pull you. And we're going to slowly lower this leg. And since you just had knee surgery, it's okay to bend that knee as much as you can tolerate, okay? And we're just going to work on sitting here on the edge of the bed for a little bit. Okay? You feel okay?
Yep.
Good. Okay, now we're going to show you a transfer going from the bed to cart using a transfer board. One of the key things that we want to think about is the height of the surface. Right now our cart is a little too high, so we want to lower that so that it's actually lower than the bed, so we're going downhill. You also want to make sure that we're communicating with the patient and telling them what we're going to do. So Danae, what we're going to do in a minute is we're going to roll you over, put a board underneath you, and then we're going to slide you over to the cart, okay? And I want you to keep your hands just like they are, and then in a minute I'll have you lift up your head a little bit. First we're going to roll. So we're going to roll her on her side. We'll get the board underneath her, and sometimes you want to put a little bit so it's between the bed and the cart, so that can help create that bridge between the bed and the cart. We'll roll her back. I'm going to get up on the bed here to help. And then all three of us are going to work together. In a minute, I'm going to count to 3, and we're going to pull her over. I want you to lift up your head. Good job. And then on the count of 3, we'll pull her over. 1, 2, 3. And then we'll remove the board, and then she'll be on the cart. we're gonna work on moving the patient. We're gonna work from sit to stand and then eventually getting them in a chair. In order to do that, we wanna make sure the room and everything's set up. So I've got the IV pole. I'm gonna wanna move that so it's on the side of the bed towards where we're going. And I want to make sure she has on her grippy socks, socks that have grips on the bottom. We wouldn't want her in regular socks or bare feet. So when we're working with a patient, we want to make sure that we have the proper footwear on. So these are regular socks, so this is something that we would not want to have. We'd want to have the grippy socks. And these are the grippy socks shown here. And they're red, so when patients have fall risk, we'll have red. Otherwise, we usually have gray or blue or different colored socks. So we just want to make sure that we have the proper footwear for the patient. I'm going to make sure the leg rests of the wheelchair, I'm going to take off the leg rests to get them out of the way so we can do a safe transfer. So we'll get these out of the way. Whoops, I don't want to hit you. And then we want to get the chair close to the patient. So we'll have a good angle and it'll be nice and close to her. We want to make sure our other lines here, we've got oxygen tubing and our NG. We want to make sure that when we move the patient, that we know where they are. And we want to make sure that our IV is on, where it's located, so we make sure we know where it's at. And we're going to get all this stuff over here. We want to make sure if we have brakes on the chair or the wheelchair that we make sure the brakes are on and that the chair is secure. We're going to use a gait belt. So in a minute, what we're going to do is we're going to stand up and then eventually we'll get over the chair. We always want to make sure we're telling the patient what we're going to do so they're aware. This is a gait belt. We're going to put it around your waist. And sometimes if a patient has a PEG tube or colostomy, we're going to want to make sure that we are aware of that. So I'm going to put this around your waist. You put that hand right there. I'm going to put snug but not too tight, okay? The 3 key points that we want to do when we're doing the transfer, one is going to be at the patient's knees. So I'm going to be at their knees with my knees. I'm going to be under her buttocks. So buttocks is one place, and then another place is on her trunk. So those are the 3 key points that I want to be at to help the transfer. So we're going to lean forward, and we're going to come up. So I'm at her knee. If her knee's going to buckle, I can snowplow or squeeze her knee. If her butt juts out to the side, I can push that back in. And if she maybe leans forward or back, I can use my body to help her get in a good position. So we're going to have her reach back with her left hand and slowly sit. Or both hands, you can reach back. Yep. And also if you have a larger or bariatric patient, you could use the multicolored belt with a bariatric patient. So that was sit to stand with about a mod assist, a 1-person assist. So one thing you want to think about is when you're pulling on the belt. When you're pulling on the belt, see how that's sort of jerking the patient around? That is a don't. We don't want to do that. And look at my body mechanics. My arms are way far out there. It's bad for my back. So just think about when you're pulling on the belt, what that's doing to the patient. Another thing is we want to think about we're going to have your hands right here. Before you and I get up, do we rock back and forth? Do we rock back and forth like this to get up? No. And what we really want them to do is we want them to lean forward. They actually get their nose past their toes. They're going to get enough weight shift. See, her buttocks is already coming off the bed. She's going to come up. So let's have you sit back down. Another thing, before you and I, a relatively normal person, get up, do we count to 1, 2, 3? No. So instead, we want to teach the patient what to do. We'd want to say to them, lean forward and come up. So teach them what the cues you want them to do instead of the 1, 2, 3. So let's sit back down. And you also want to weight shift with the patient too. If I'm here and I'm going to transfer with her, if I shift my weight towards there, what does that make you feel? Which way do you want to go?
Backwards.
Backwards. So I want to weight shift and I want to move with the patient. So if I'm weight shifting and using my legs, then both the patient and I go in the same direction. We'll have you sit back down. So those are don'ts. So we don't want you counting 1, 2, 3. We don't want you rocking back and forth. We don't want you pulling on the belt, because look what that does with the patient. It doesn't feel very comfortable. And you want to move, or your extension of the patient, you want to move together as a unit. Okay, now we're going to do a max assist ×2 with the patient. So what we're going to do is each staff member, therapist, you're going to be at their knees. You can use one of your knees or both of your knees. We're going to go under their buttocks. I'm going to get the one arm, I'm on the weaker side, and we're going to go towards the stronger side. And the other person is going to be on their back, and then when we come up, we're going to move their hand to the front. So the 3 key points that we want to be with the patient is we're going to be at their knees, and I'm going to be, this is her, right side is her weaker side, so I'm going to have her grab onto my arm with this arm. Her left arm she can push up. We're going to, both of us are going to go under her buttocks, and then her arm is going to be in the back, and then when she comes forward, she's going to bring it forward. So we're going to be under her buttocks. We're going to tell the patient what we want to do. We're going to lean forward and come up. So we've got under her buttocks, we've got both her knees. If she tries to bend her knees, we got them, we can snowplow them. If she maybe puts her butt back, we can get under her. And if she leans forward, we can get her back. So we're under her, and we've got 3 key points that can help facilitate the patient standing. So now we're going to slowly sit down. I want you to reach back with your left hand. We're going to slowly sit on the bed. And we were moving and weight shifting with the patient. Some key transfer tips that we want to think about when we're doing the transfer with the patient is the placement of our body with the patient. So one key area that we want to be is on like their knee. We want to be on the side of their knee. We don't want to be really in front or way back in there. We just sort of want to be on the side of their knee so we can help control this knee. And usually we're on the more involved side or the weaker side, or if they're both maybe just deconditioned, whatever side you feel more comfortable on. And sometimes you can use both your knees, or maybe if you want to just use one knee, depending on your body type and their body type. The other key is under their buttocks. I'm going to be under their buttocks on their weaker and more involved side, and then my other hand's going to be on their trunk. So we're going to have them lean forward and come up. And then if this left knee would buckle, yep, I could snowplow it or sandwich it right there. If this left hip juts out to the side, I have my hand right there. I can give a cue there. Maybe if they start leaning forward, I can move this hand and then give it back. And this, yes, I would have them hold on to the back of my arms just like she's doing. So now I have a secure hold on their knee, buttocks, and then on their trunk. Those are the 3 key points. Another thing we want to think about when we're doing the transfer is the placement of the patient's feet. Right now, her feet are way far out in front of them, and that's too far out. So what we want to do is have her feet come back underneath her so that she can help with the sit to stand and really use her legs. And we want them even and not too close together, but far apart. So that's going to help with sit to stand when we have proper foot placement. Right now, another important transfer tip is the placement of the patient, if they're at the back of the chair or at the edge of the chair. Right now, Leisha's at the back of the chair, and we actually want her on the edge of the chair. So we can help facilitate it a little bit, and what we want to do is move to the edge of the chair, so I can help sort of butt walk her from side to side. We get her right at the edge of the chair, so that's going to help with the sit to stand. And we get her feet under her, and then we have her lean forward, and that's going to help with sit to stand. Another transfer tip that we want to think about is the height of the surface that the patient is coming from. Right now, this is an okay surface, but if this is a tall person, this might be difficult for them to sit to stand. So Lisa, can you try to stand up, please? Oh no. So we're having some trouble. So what we could do is we're going to have her stand up, and I would do this before she'd move. We'll get her out of the way. We can build up the surface to make it higher, and then when the patient's getting out of the chair, it'll be a lot easier to get out of the chair. So I would recommend using the bedspreads. These are a lot thicker and do not smush down as much as a pillow. So this is what we want to do, is build it up, usually 2 or 3 bedspreads. We'll put the sheet over top of this, make it nice and neat. And also put our pad on here. And then we'll have Leisha come back, sit down. Now, actually she's a little bit taller. We're going to have her come to the edge of the chair. Get those feet under, and actually we want her nose past her toes. We want her to weight shift forward. If she gets her nose past her toes, she'll be able to stand up just like that. Okay, so now we're going to be moving the patient from the bed to the wheelchair, and the patient is a mod assist. The patient is doing about 50% of the work, and I'm doing 50% of the work. We want to go towards the stronger or the less involved side if one side's a little bit weaker than the other, or if you'd have a patient that's had a stroke, you definitely would want to be on the more involved or the weaker side. We're going to have them be able to push up from the bed. I'm going to be at their knees. I'm going to go under their buttocks and their trunk, and we're going to tell the patient what we want them to do. We also want the patient to help as much as possible. So first see what the patient is able to do, and then you give your input. So what we're going to do is we're going to stand up, and we're going to take a couple steps and get over in the wheelchair. Okay. We want to make sure we know where all our lines are and everything too. So we're going to lean forward, and when we're up, you can grab onto the back of my arms. So we're going to lean forward and come up, so you can grab on the back of my arms, and you're able to move your left foot. So move your left foot I'll help move this foot a little bit. You move your left foot. Yep, and do you feel the chair behind you? Okay, we're gonna reach back for the chair, and we're gonna slowly sit down. Yep, and so now they're in the chair, and I moved with the patient. Now we're gonna do a max, a 2-person assist from the bed to the chair. So we're gonna do a 2-person assist. So we wanna make sure we know where the catheter is. We wanna get that underneath them. So we're gonna do a stand step. So I'm gonna be on the more involved side or the weaker side. Leisha is on the stronger or the less involved side. So we're gonna have her push up with her left hand from there. I'm gonna have her grab onto my arm. We're gonna go under her bottom. We're gonna lean forward, and I want you to help us as much as you can. We're gonna lean forward and stand up. Now I'm gonna shift you. You're gonna shift over towards me. You can move your left leg. I'm gonna help move this right leg. Shift towards me. Yep, we're gonna help you facilitate. And I want you to reach back with your left hand, and we're gonna slowly sit down and get in the chair. So that's a max of 2 with a stand step transfer. And then now we're not gonna, maybe she's not able to take any steps, so we're just gonna sort of get her up and then try to pivot her over to the chair. So for some reason, she's not really able to move her feet. So we wanna get, as Leisha pulled the chair over, we wanna get it right nice and close. We're gonna get under here. You're gonna grab that, we're gonna get under her buttocks, and we're just gonna turn her and maybe get her over in the chair. Yep, good job. Okay, today we are going to do a transfer with a patient who is a modest cyst, which they require 50%, and the therapist is doing 50%, and we're going to use a walker. So first we want to make sure where our lines are. So we've got our IV line, we've got the oxygen, we've got the catheter. We want to make sure we have enough slack, and we're also going to use a gait belt with the patient. So we want to put the gait belt around the patient. You want to make sure if they have a colostomy or any tubing in their stomach that we want to be careful with that. And then we'll also use the walker with the patient. And then we want to make sure that we tell the patient what we're going to do so they know and they can help assist us. So today, my name's Melissa, and I'm a physical therapist. We're going to go from the bed to the chair using the walker, okay? We're going to grab the catheter. We're going to put that on the walker. I'm going to put it, can you kick that leg forward a little bit? Thanks. We're going to put it, we don't want it too high, so it's going to be low, so it's lower than the bladder. We also have a clip that we can put on the gown, so we can use that to get it off the ground. Okay, so what I want you to do is you can have one hand on the walker, one hand on the bed, and then in a minute we're going to stand up. Yep, and then we'll use a walker to get to the chair. So I want you to push the walker, move one of your, yep, and then the other walker. Okay, and I'm just going to switch sides here. Make sure all your lines are got enough slack and you won't sit on anything. Okay, do you feel the chair behind you? Okay, I want you to reach back with one of your hands, and we're going to slowly sit down. Good job, and we'll have you sit up in the chair for a little bit now, okay?
All right.
Good. Okay, so now you just had knee surgery on your right knee, and also if you if you had hip surgery, that'd be your surgical leg. You're allowed to, it's called weight bearing as tolerated. You're allowed to put weight on it, and for us to move from the bed to the chair, you're going to move the walker first, your right leg, and then your left leg when we're moving forward. And you're allowed to put as much weight as you can tolerate. Yep, and I want one hand here on the bed, one under there. I'm going to come under your buttocks a little bit to help assist you. So we're going to lean forward. Both hands up on the walker. You're going to move the walker forward first, your right leg. When you step on that, put weight in your arms. Move the walker a little bit more forward. Yep. You want to not go so far into the walker. So you want to get that up there. Yep, and then move that one. And now to go backwards, you're going to turn the walker a little bit. You're going to move your left leg first, and then your right leg. Walker, left, and then right. Walker, and then right. And you want to make sure the chair is behind you, and then you're going to slowly sit down. So we can even leave the catheter was fine where it was. We could leave it on the bed, or if I wanted to, I could also, can you bring that leg? We could also have put it on the walker. Either way can work. You just want to make sure you have enough slack and that the catheter doesn't get pulled. Okay, now we're going to show you a transfer using a sliding board, and the patient is going to be modest cyst. So that means the patient requires 50% of the work, and then the therapist is doing 50% of the work. So some of the things that we want to think about when we're using a sliding board are the reasons why we'd use a sliding board. Some would be for weight-bearing restrictions. Maybe they're non-weight-bearing on one leg or both legs. Or maybe they have some precautions, some hip precautions, or other reasons why they're not able to bear weight on either of their legs. That would be why we use a sliding board. So things we want to think about is our lines. We've got our IV line, our catheter, and our oxygen. We want to make sure that we have enough slack when we move the patient. Also the placement of the wheelchair. We want to get it close to the patient, usually on an angle. We want to make sure we have both the brakes on. And we'll take off this armrest so we can make the sliding board work and easier. And this is our sliding board that we're going to use. You want to put a pillowcase, or if they have shorts on, or even those slippery wind pants, that will help them move. We also want to make sure that we put the gait belt around the patient. We also want to talk to the patient and tell them what we're going to do. So Danae, I'm going to put a gait belt around you. You lift your arms up a little bit. You want to make sure if they have a peg tube or any colostomy or anything that we're careful where we place the gait belt. So I'm going to put it on her snug, but not too tight. And then you also want to communicate with the patient and tell them what they're going to do. So Danae, what we're going to do is we're going to move from the bed over to the chair using the sliding board. Okay? So another thing you want to think about is the height of the bed. You usually want the height of the bed a little bit higher than the surface you're going to, because then you're going downhill and it's going to make it easier to do the transfer. So Danae, I want you to lean this way to the left a little bit. We're going to put this about mid-thigh. We're going to put it under her. And can you come back? And then I want you to help me. You can put your hand on the board, but I don't want you putting it under it or through the holes, because then you can pinch your fingers. Okay. And then I'm going to get in here. I can still use her buttocks and the trunk. That's where I'm going to help facilitate. And we're going to slowly, just want to watch your lines. I'm going to slowly, take incrementally, go over. From the chair. And then we got her over there. And then I want you to lean. Can you lean this way a little bit? And we'll get that board out. And then now we're going to have you sit in the chair for a little bit. Okay? So now we're going to go over a sliding board transfer when it requires assist of 2 therapists or 2 staff members. The patient would be a max assist times 2. So the therapists are doing 75% of the work, and the patient is doing about 25%. And some of the reasons you would use a sliding board include maybe non-weight bearing on one leg or both legs, or if they have some other precautions, or maybe they're just not able to stand on your legs, or maybe if they've had a recent amputation, then we would use a sliding board with them. Some of the things we want to think about include the lines. So we've got the IV line, the oxygen line, and also the catheter. We just want to make sure we know where those are. And also we want to make good placement of the wheelchair. So we're going to have it real nice and close to the patient at an angle a little bit. We're going to take off the armrest. We're going to put a gait belt around the patient, so we have that if we need it. You want to make sure you know where all your lines are when you're putting the gait belt on. We're going to put it around their abdominal area. We want it on there snug, but not too snug. And if they have a peg tube or a colostomy, then we'll probably put the gait belt higher. And then if the patient has shorts on or this pad, that's something that we can use to help with the sliding board to slide them over. Another thing to think about is the height of the surfaces. So this bed's a little bit higher than the chair, so we're going to be going downhill, so that's going to make the transfer easier. And then once a 2-person, I'll be in front, and Alicia's going to be in back to help assist with the transfer. So we're going to place the board under the patient, and then we always want to make sure that we're talking to the patient and telling him what we're going to do. So Danae, what we're going to do in a minute is move from the bed over to the chair using the sliding board. Okay? So we're going to have you lean to the left. We're going to put this about mid-thigh, and we're going to put it under the pad, and then we're going to have come back. Then I want you to assist us as much as you can. You can put your hand on the board. We just don't want it under or through the holes because you'll pinch your finger. Okay. Okay, so I want you to place your hand there. Alicia's going to be behind. Can you just open your legs a little bit? I'm going to be here on her trunk and her buttocks, and then we're going to talk and work together, go in steps. So we're going to slowly slide over. Yep. Okay, then we're going to have her lean, and we'll take out the sliding board. Good, and then we're going to have you sit up in the chair for a little bit. Okay? Thank you. Okay, a device we can use is called a Give More sling. So if our patient's had a stroke or they're weaker on their right side, this is a device that we can use with the patient to protect their arm. So we've put the Give More sling on her. I'm going to be on her knee. I'm going to be on her weaker, her more involved side. I'm going to go under her buttocks. I could either go here, or if I want to go in here, We feel a little more comfortable there, so I'm going to go on her buttocks and her trunk, and we've got the sling on her arm to help protect her arm. So you can lift up, you can do that with your left hand. You can push from the bed. We're going to lean forward. We're going to come up. You can move your left leg. You can grab it on the back of my arm, yep, if you want. And we're going to move. I'll help move that one leg, move your left leg. You're going to reach back with your left arm, and we're going to slowly sit down. So if you can see there, her arm was protected, and it wasn't moving around, and we knew where it was, and so that's good for when we do the transfer with the patient. Another transfer tip that we can do when they're walking is to have our hands on either side of their hips, so I can help facilitate. Maybe she's stuck or she's not moving. I can help weight shift her. So by me weight shifting her, I can get her to move. And then I also want to do steps just like her, because then it's transferring me to her. So I'm paralleling or doing exactly what she's doing. And if she takes little baby steps, but I want her to take bigger steps, one, I can tell her to do it, but then I can also try to take bigger steps to help facilitate her moving and taking bigger steps. So now we're going to show you how to put on my AmiJay, which is a neck collar brace. One thing we want to look at is if we have, it says front right on here, and it also says up. So we want to make sure when it says front and up that we are putting that on the front of the patient. The other piece of the collar says back, and there's also arrows for up. So we just want to make sure that we're putting the back on the back and the front on the front. And how we get this on the patient is we're going to have them log roll. So Danae, what I'm going to do is have you log roll. If you can roll that way to your left. Good job. And we're going to put this underneath her neck, right under there. And then we're going to have her roll back. We want to make sure that it's even, that one side's not higher or lower than the other. So that looks pretty good. And we're going to put the front piece on. So we put it on there. And then we've got the two straps. We'll put it on there. We want it snug, but not cutting off the circulation. We want to make sure it's a proper fit. If it's not a proper fit, then we either want to notify nursing or the therapist or the DME company that got the brace so that we can get a proper fitting brace for the patient. You feel comfortable? Yep, okay, good. This is another brace that we're going to go over today. It's called the TLSO, the thoracic lumbar sacral orthosis that a patient could wear. And what we want to do when we get on is we want the patient to log roll, but another important thing to think about is we want either them to have the gown on or a t-shirt. So in order for them to log roll, Danae, we're going to talk to the patient and let them know what we're doing. We're going to have you bend up your legs, and I'm going to have you reach over and we're going to roll to the left side. Yep, so we're going to tuck the brace. We're going to tuck it as best we can. It's not very comfortable. We'll just tuck it as best we can. And I'm going to have you roll back. Yep, maybe roll towards me a little bit. We could also put the rail up there so you can grab onto the rail. I'm going to probably switch sides so I can get under this brace, and then I can pull the brace forward a little bit. Yep, and try to get pretty good placement. So you want that good right in the middle of the spine. So I'm going to have you roll back, Danae, towards me. We're going to put the front piece on. I'm going to tuck it in. So we're going to get it right in there, and we're going to put these straps all the way through. The same thing, we want it snug, but not cutting off the circulation. You don't want them to get any sores from the braces, so they're getting any redness or sores. We want to make sure that we talk to the nurse or the therapist or call the DME company to have them come back and make sure the brace is properly fitting. We're going to get both of these in here. Usually want to try to tuck that in. You feeling okay? Mm-hmm. You probably want to adjust it, hip just a little bit. Make sure that's a little bit, you need to adjust it a little bit more. It looks like it's, yeah, there we go. Get you a little bit more even. That looks a little bit better. Okay, you want to make sure you have a proper fit because these patients are going to be in these for a while. In order for you to get up, we're going to log roll. I want you to come towards me. I'm going to help with your legs. And we're going to help you come under here, under your shoulders, and we'll pop up. Then you can also look in the back and make sure that looks pretty straight and even. So sometimes when they're up, if it's off a little bit, we could turn it to the side, but it looks pretty good. Feeling okay? Mm-hmm. Okay, good. Okay, so another thing we're going to show you today, it's called the Give More Sling. It's a device that we could use with someone that's maybe had a stroke or that has a weak upper extremity to help protect that arm. So we're going to show you how to put on the Give More Sling. Her left side is going to be her weaker, her flaccid side. So the shorter side of the sling, that's what we're going to put under her less involved side. We're going to put that under her arm. And this here in the back, we'll have her turn a little bit. We want to make sure we can see the writing, so then we know we have it on there properly and it's facing the right way. And this other one's going to go under her other arm. We're going to do that, and then we're going to place her left hand like right in there. And that's below her elbow. Yep, and right there. And we want a little bit, I think we want to make it a little bit longer. So we want her arm, maybe only about a 20 to 30 degree bend in her arm. So we're going to give her a little bit more. There, that looks pretty good. And we want this other strap right below, about 1 inch or so below her elbow. So her hand's protected in there. We've got this below her elbow, and that's the Give More sling. And we can have her walk a little bit. So let's have you walk, Danae. And then it's protecting her arm. So her arm's in a good position. It's protecting it. It's just not flopping in the wind, or we know where it is and the person knows where it is. So some of the benefits of the Give More sling include reduces shoulder subluxation. So that's when your shoulder, it can drop in there, the muscles get really weak and our shoulder can fall. So that can help prevent that. Reduces shoulder pain. Supports the arm in a functional position. This is usually where we have our arm at our side. Increases balance. Improved gait. As we talked about earlier, it protects the arm. We know where the arm is. Allows the controlled arm swing. So when she's walking, we'll have you walk a little bit again. Yep, it's moving. You do that arm swing. And also it's relatively easier for the user to apply. So this is called the Give More sling, something we can use with someone that's maybe had a stroke or has a weak upper extremity.